Okay, good evening, everyone. My name is Ariel Porat. I'm the president of Tel Aviv University, and it is my pleasure to open this webinar on exiting the corona crisis wisely. Let me say a few words about the activities of Tel Aviv University during the coronavirus crisis and afterwards. So, first of all, at Tel Aviv University, there are many laboratories where our researchers work on finding immunization and therapies and cure to the virus. And there were several breakthroughs at the university. This is obvious that Tel Aviv University, probably with almost all universities in the world, try to find cure to the disease. Now, in addition, Tel Aviv University has more than 130 researchers outside of immunology and virology, working on issues related to the coronavirus crisis. So people coming from epidemiology and from data science and computer science and law and economics and any field that you can think of is relevant this way or another to the corona pandemic. And as I said, 130 researchers, which is about 12% of the total number of senior researchers at Tel Aviv University working on related fields during these days. But Tel Aviv University also participated in several activities that contributed directly to the state of Israel and to the people in Israel. And let me say a few words about those activities, which are usually not regular, right? Usually researchers do basic research, but we have tried to contribute to, the nation in different ways. So one thing is that we established a digital platform where more than 1,000 researchers from all the research universities in Israel participate, writing memos and consulting the Israeli governments and agencies in any issue that you can think of, which is related to the corona crisis. There are more than 30 working groups. It started as a project of Tel Aviv University, but very quickly other professors in other institutes heard about this initiative and wanted to participate. So now it is a project of the entire Israeli academia. We are very proud of being the leader of this fantastic initiative. Another activity which is worth noting is that about a month ago, we established a special laboratory at the Tel Aviv University campus, where not only research on corona can be done, but also tests for corona can be conducted. We have waited 3 or 4 weeks until the Ministry of Health approved this laboratory. And I'm very glad to say that starting last Sunday, more and more tests are conducted at the campus of Tel Aviv University. At the moment, Tel Aviv University is the only academic institute which conduct such tests in the campus. And we are very proud of this contribution to the national effort to have more tests. And as you will see later on from some of the speakers today, that the number of tests is crucial to the exiting strategy from the corona crisis. Now, another initiative that started at Tel Aviv University, which we are very proud of, is collaboration with the Israeli Mossad. So some of us noticed about a month ago that both the Prime Minister and the Ministry of Health might be benefited from a think tank of researchers in all related fields that could work with them and consult them about handling the crisis, and later on different ways to exit from the crisis. So we contacted with the Mossad, because some of you might know that at a certain point, it seems that the Mossad, in a way, took over the management of the crisis together with the Ministry of Health. And we observed that if we want to have a real effect of the exit strategy of Israel, we might collaborate with the Mossad, and that's what we had done. So we composed a group of researchers, some of them from Tel Aviv University. Later on, you will hear more from Adi Posner, who was one of the central figures at this committee. So we composed a committee of researchers, like 15 researchers, like top researchers in different fields from all the universities, all the 7 research universities in Israel. We worked very intensively with the Mossad, and I'm very proud to say that we came out with a very impressive strategy. I believe it's kind of a model of how to handle pandemics, not only the corona pandemics, but also future pandemics that we might have in the future. Last thing that I want to mention is that just a few days ago at Tel Aviv University, we established a new center for combating pandemics. As far as I know, again, this is a multidisciplinary center, not only on biology, but on all the relevant fields, actually all the fields that you can think of. And because one thing that we have learned is that pandemics is a kind of a multidimensional phenomenon. And if you want to handle it correctly, you need to combine forces from all disciplines and not only from the core of biology or epidemiology. This is, so as I say, this is again a new initiative of Tel Aviv University. We were even lucky to raise some funds to start to make this center operative, and it wouldn't work only for the corona crisis, but also from other pandemics that we probably might have in the future. So these are some of the activities which has been done at Tel Aviv University. Some of you are going to hear about some of those activities in the next hours from the speakers. All of them are professors at Tel Aviv University. As I said, we are very proud not only of the quality of the research done at Tel Aviv University around the corona pandemic and the coronavirus, but also about the initiatives that contributed to the state of Israel, and I believe also contributed globally. So I think at this point, I would ask my colleague, Dr. Bruria Adini from the School of Public Health to take the lead and be our moderator. Thank you very much.
Thank you very much, Professor Porat, for your inspiring words. And I would like to follow on our ability to contribute to the process of a wise exit from the COVID-19 crisis. Now, we've heard from varied leaders that the COVID-19 is first and foremost a health crisis, and that our first priority is to save lives. Then we need to focus on the economic system, followed by societal repercussions, then maybe the political ones, and so on. I would like to suggest a different perspective on how such global or national crisis should be managed. There are no hierarchies in crisis management, as societies at large, and each of us as an individual, are much more complex than that. The different systems are intertwined, and there are close interdependencies between our physical and mental health, our confidence in being able to support our families, our trust in the leaderships, our belief in the societal resilience. This is why in the past few years, we refer to our well-being, which is a much wider and more comprehensive concept than just being healthy. So a basic component of maintaining the resilience of our societies is planning for potential adversities. Unfortunately, the COVID-19 has shown us that we were not sufficiently prepared, and that the entrance strategy in many countries, including in Israel, was not implemented as we want it to be. So we can't change the past, but we certainly can and must learn from it to the future, and that is why we want to more efficiently plan the exit strategy. In this webinar, we will discuss the varied aspects of the crisis management and the exit strategy leading to the beginning of the recovery phase. I would like to thank all of you for joining us and invite you to raise queries. You can do so through the Q&A button on your screen, and we will try to relate to as many questions as the time will allow us. So in the effort of discussing together the questions that concern us all, we have with us today Professor Ariel Munitz. Ariel spearheaded the establishment of a corona testing lab at the Tel Aviv University that assists the Ministry of Health in testing the society for the presence of COVID-19. On top of that, he developed a unique serological test that is both rapid, robust, highly accurate, and sensitive, and it's currently used among the Israeli soldiers in the hospital, and it's also been submitted for the approval of the FDA. We have with us Professor Irad Ben-Gal. He's the head of the Laboratory of Artificial Intelligence and Machine Learning in the Department of Industrial Engineering at the Tel Aviv University. Irad heads the TAU Stanford Digital Living 2030 research project and worked during the last months on the construction of the AI platform that analyzes the dynamics of the COVID-19 pandemic over the state of Israel. And our third speaker is Professor Adi Posner. He's the former head of the Berglass School of Economics. He's a member of the Inter-University Committee that worked with the Mossad, that Professor Porat related to that just a few minutes ago, on the exit strategy. And he also heads the academic IL COVID-19 Impact Initiative, which again, Professor Porat related to. So I would like to refer the first question to Ariel. And I would like to ask you, what do we know now about the COVID-19 that we just were acquainted with it 5 months ago? And what mechanisms should now be implemented that will allow us to return to normalcy without compromising the public health?
First of all, thank you very much for joining this webinar. And Gloria, I want to join you with this intertwined view of this pandemic. In terms of your question, I think that the first thing that we learned is, first of all, to be humble. I mean, really, to be humble and to understand that we are always in the process of learning. What I would like to do, I would like to refer this question into the way I see it, and I see it through someone who's studying immunology over the last few years. And referring this to your question from a health perspective, I think that we are on a very steep learning curve. And in this learning curve, we understood that not every virus behaves like the previous virus we know, even if it is coming from the same family. We learned about the fact that we really need to understand better the biology of this virus, and most important, how our body, as a response of the host, will cope with such a new challenge. If we now look into the immune system as an example for that, we can divide the immune system into two parts. The first part, I would say, is the primitive part, and may resemble, you know, every fence which is present at the border of every nation. And this fence is a very primitive way of avoiding people or intruders from coming in. And this is the first line of defense. The second line of defense is the defense which is much more sophisticated, where you bring in your more sophisticated weapons. And that is the weapon which we call in immunity, the memory response. What I think is the main thing that we learned, again, is that these two components work together, and we were able to see it actually happening in real time, because we were able, I think, for the first time, to really study host responses of human beings towards viruses as they happen. We could follow patients from day 0 to day 40 and 50 after they were infected, and we could really understand how our body responds to this virus. So we learned a lot about the heterogeneity of different populations. We learned about the fact that different populations and different governmental measurements could bring to extremely different outcomes, even in neighboring countries. And I think that now the main issue is to integrate all of this knowledge into a specific set of instructions in order to enable us to free out the economy and to establish our life in the shadow of this new pandemic.
Thank you, Ariel. And you spoke about the defense mechanism and the need to intertwine different sectors together. And I would like to ask you, Irad, from your perspective, could you elaborate on the work that you did with the Mossad and about the COVID-19 exit plan and its contribution from the TAU contribution to this vital process of exiting the crisis?
Okay, so thank you for having me. We had a joint work with Dr. Dan Yamin from the lab of epidemic modeling. Dan is an expert in epidemic modeling, and what we did is to use aggregated and anonymous cellular data to analyze real-time 3,000 regions over Israel. In each region, we analyze actually human mobility patterns that are, of course, very relevant to the way that the epidemic evolved and the dynamics. Both we talk about patterns within the region and patterns between regions. On top of that, we had the layers of information about age distribution, family size, and other social demographic features that are very relevant to each segment. And we could actually analyze the way that the population in each region was reacting in response to regulation or recommendation of the government. And using that, and based on the epidemic rates that we got from the Ministry of Health, we could create a local epidemiological modeling per each region and see how the disease evolved and actually forecast what will happen next. And of course, this type of modeling helps not only to monitor the current situation, but help you to forecast what is the best way to anticipate the best plan to exit gradually the quarantine regions and to open it gradually to full action. And what we did, we supported it with a simulation and a decision support tool. And if I have time later, I can show it, but it's really an interactive system that helps decision makers simulate a possible action, open a region, close a region, and see exactly what will happen in terms of the all the dynamics of the coronavirus epidemic. So this was the main focus of our work in the last months.
So again, we see that the contribution of working together and bringing many innovative ideas to the same table, making us that much better prepared to go to the next step. I would like to approach you, Adi, from your perspective and your work on the exit plan. How can you relate to additional steps that should be implemented in order to bring us safely to exiting the crisis?
Oh, thank you for the question. Thank you for having me. So I will talk a little bit about the exit plan that we proposed, which is not at the end the exit plan that Israel is following. And indeed, the idea was to find a balance of how to maximally open the economy while containing the epidemic at reasonable levels without having to lock down again the economy. And the idea was to take steps which basically were to divide the country into small regions and monitoring all the time what was happening in each region, using the models that Irad was talking about, and a lot of monitoring of the state, testing all the time the population in each area and seeing what is happening with the epidemic. And the idea was that region would be either green, which means that the level of infection is low and it's not propagating much, so that these areas can be really open. Areas that had an outbreak would be red, so they would be almost like, basically like in the lockdown that we just had. And yellow would be areas that are in risk, so that you allow for people to circulate within the area, but you're very careful not to let them go out and infect other areas. And and the idea of monitoring all the time is really important, because what we really want to know is what is going to happen to the ICU at the hospitals. Are we going to have an overflow of the intensive care units? And for that, you need to know ahead of time what is happening, because once you see a surge in the intensive care units, in the people in critical conditions, and you impose a lockdown somewhere, it takes 2 weeks for that to have an effect, because of the time from infection to symptoms, and from symptoms to getting into critical conditions. So the important thing was all the time to monitor what is going on, and using those models in order to predict ahead of time what is going to be the effect on the hospitals. So the things that I'm right now, what happened is that Israel chose another path, which is maybe easier, but it's basically opening everything. And I really, really hope that that it's going to work. In terms of the infection rates, things are not so different today than they were when the lockdown started. The number of infections is not very different. So the things that are maybe different is the weather. Maybe people are used to better hygiene. Maybe the ability of the health ministry to do the tracking of the infected people is better. I'm not sure this has happened. So I'm really hopeful that this opening will work, but there's some chance that we'll see a surge and we might have a lockdown again. And I would have preferred a much more careful and a way that was monitoring all the time and trying really to reduce the chance of an outbreak.
Thank you very much, Adi. And this is something that all of us, both in academia and other arenas, have to take into account, that we can recommend, we show the data, we do the research. Sometimes these are applied and sometimes they're not. We continue. That's our role and that's our importance. I want, Ariel, I'd like you to relate to what Adi said, looking into a potential second wave. And we've been hearing more and more some very disconcerting predictions about that. And I would like to ask you, going forward, while looking back at what we have learned and considering the potential of this second wave, what in your opinion is the more effective model of managing the COVID from what we've learned, both from our mode of managing and other countries?
So I think that basically one thing that I want to also say in respect to what Adi mentioned before is that monitoring, I think, is key. And we should monitor from now and into the future in two ways. The first way to monitor is by doing the regular tests in elderly populations specifically, because those populations are more prone for infection. And this could be relatively easily done because most of them are going to be in care houses, and we can relatively get in contact with them and get their samples. The second thing is obviously going into serological testing, and we should obviously do serological testing, especially I think looking into IgM molecules, because these are molecules which relatively rise up early in infection, and they would tell us when an acute infection is occurring. And while we do both of these, I think we should take these at least until the next winter, because what will happen in the next winter is a key question. And the reason for the fact that we're anticipating a second wave in the winter is because we do not know how this coronavirus will behave in addition with the regular flu. Now, one thing that I must share my concern is the fact that when we're talking about vaccinations, it is not clear that we will have a vaccine until next winter. But because we are working rapidly on generating a vaccine, the pipelines for generating vaccinations throughout the world, and these are industrial pipelines, which are usually taken to generate vaccines for the flu, might be overtaken by, might have even problems and shortages of vaccines for the flu. So we might have, again, an integrated problem of, on one hand, corona re-entering our lives, and flu on the other hand, which we don't have enough vaccines. So this is something that we should definitely take care of. One thing that I can say that we're trying to do, and one thing that we have been able to do throughout this time period, is this serological test which you mentioned. And the serological test which we developed, I think right now is the only one in the world which could actually bring data into the appearance of IgA, IgM, and IgG, which are 3 antibodies which have different kinetics. And by using the combination of all 3, you could actually determine sometimes the root of infection. You can get a lot of potential scientific data and translate this into understanding how to reopen your gates or how to behave towards the second wave.
Thank you very much, Ariel. And you related to the data that we need in order to monitor, in order to actually decide how to manage the crisis. And one of the questions that our participants ask, and Adi, I would like to ask you to relate to that, and afterwards, of course, also Irad and Ariel, what have we been doing to share the data and the findings, or even our recommendations, to share with others, not only in Israel, because you related to that, Adi, but also to other colleagues throughout the world and throughout other academic institutions?
Well, this is a very good question. And I think that the data story is the big story of what is happening now, because we have the same pandemic all around the world. And it really showed us that the data sharing is not so good. It's not so good. Every researcher is trying to find his own connection to data, to trying to find everybody's working on getting the same data, and maybe we're learning now the need for a global organization that will permit online something much faster in terms of organizing the data from everywhere. It's true that research now is in medicine is being semi-published without referring very quickly. So there is some access, but still raw data is not accessible, not on tests or surveys all around, but also on the research that is done. So I have nothing really to say, just that we have to learn how to do this. We have to learn how to do this. We're trying to do something like that in Israel right now on a national level. We're pushing to this, but something global is needed.
I'm sorry for butting in. I just want to continue on what Adi said. Initially, and this is my own personal experience, at the beginning of this pandemic, I was really excited about the fact that people are sharing their data immediately, publicly, on online servers. But as we gradually went into this COVID-19 disease, I saw that it brings so much confusion, because you have no way to scrutinize which data is accurate and which is not accurate. And since we don't have the ability to generate, an accurate picture of what is going on, you start making multiple assumptions. And these assumptions are made by people studying economics and mathematicians. And when you want to gather and integrate all of this information, you really need the solid data. So what started out as a very good idea and a very good cause, I think eventually caused a lot of confusion, and everybody could find his own, guru to say, this paper did that, so this is what I'm doing. This paper did this, so this is what I'm doing. But it wasn't helpful eventually. So there was a lot of confusion in the field, and I think that this is part of all the turmoil that is going on. We really need to understand what is accurate and what is inaccurate, and not to speak just what we think is accurate.
Irad, I think Ariel touched on a very important point. Can artificial intelligence in any way help us to try to look through the different data and understand what's consistent, what's not consistent, what's more or less recommended for use?
Yeah, so of course the garbage in, garbage out rule works also with AI systems. So everybody should be careful when you feed inaccurate data to AI algorithm, you'll get inaccurate results. And this is why we tried to consolidate and have data that is reliable enough. And the way that we thought we should share it, by the way, not only in Tel Aviv, but also around the world, because we are both publishing papers about the way that we try to address the modeling of such a pandemic at a level of a country or a region, is to consolidate it over a platform. And you know, if I may, I will just show you a view of that. So this is a view of the current movement in different regions over the state of Israel by the colors, and we have actually cities where you can see based on 10 of thousands of you know, cellular mobile movement, how people are actually moving within those regions and between those regions, and this is quite reliable. And you can actually then analyze how people are moving from one region to another. And eventually, on top of that, you can create a model that is based on those movements, as well as all the other features that I mentioned before, the social demographic data and so on, that is, again, available, reliable, and most importantly, non-invasive in terms of privacy of people, and yet get very good result in terms of the expected rates of the COVID-19 in this case, in each of those regions under different type of policies. And what you see here is a simulation. And of course, as Adi was mentioning, we have not only how it looks over the map, but based on those learning model, we can anticipate what will be the case in terms of the number of people hospitalized in intensive care unit, or actually those that will need the transpiration machine and so on. So overall, if you treat the data...
למה נתפס? מה, החליפה לי את זה?
Sorry?
It's okay.
Okay, so I'm saying you treat the data well, and you plug in only you know, reliable sources, and at the same time you are able to connect them with good models, and you can actually expose them in a way that you can get feedbacks. When we got feedbacks from different experts, some of them led to some modification of the parameters and so on. But once you have it, I think that as a system is the best way to get transparency and to get rid of the confusion that Adi was, or Ariel was mentioning before. We need some good way to translate all those papers to something that is that can be seen and can be understood by decision makers and by the public as well. So this is my 2 cents about the way that AI can help. One of the ways that AI can help.
Thank you very much, and certainly something that all of us would like to use. I want to relate to something that Irad said. He talked about different policies, And Adi, I would like to refer this question to you. We've seen globally different models, different policy being initiated. Some, like Israel, full lockdowns. Other, like Sweden, said social distancing and didn't fully stop the economic systems from working. What can you relate to the different policy, and what can we actually learn from these different types of management?
Yeah, so basically, I'm very happy that Sweden is doing something different because all the countries are doing the same. So it's really nice that one country is doing an experiment, and an experiment which is succeeding. So I just want to give you the Swedish numbers. You know, Trump likes to, and Netanyahu likes to say how the Swedish are maybe have too many deaths. It's maybe true that they have more than their neighbors, but if you look at it in absolute numbers, I just looked just a minute ago at, maybe I can share the screen. So this is the figure for Sweden, and you see this is the daily number of deaths. And Sweden is not having a lockdown. As of now, they have 3,000 deaths, which is about twice what their neighbor have. But 3,000 deaths for a country of 10 million is a third of a tenth of a percent. And as you can see, it really seems that they already passed the peak of the disease without having a lockdown. And it is really very reasonable to assume that they will not pass go to more than 10,000 deaths. And this is, Sweden is a country where flu kills between 3,000 and 4,000 people a year. So we're talking about 3 times the flu without doing anything drastic, without breaking the economy, without interfering with the freedom of people, and without having the huge health costs that the lockdowns have. So the lockdowns are very expensive also in terms of health. People are not getting any treatment for anything which is not Corona. So we're going to see a lot of deaths which are not related to Corona. So I'm really glad that Sweden is showing us this example. And in fact, the numbers that we see from all over, the serological surveys are just starting to come. And the problem is that we were fed with really scary numbers of the percentage of people that were going to die from the disease, and the numbers that were based on miscounting the number of infected people. Only a tenth or maybe a tenth of the people who are infected are counted. Most people go undetected, either because they're asymptomatic or just because they're not tested, the symptoms are not severe enough. And so when you think that so few people are infected and you look at the number of deaths, then it seems that the rate, the infected fatality ratio, that's the term, is really high. But once now we're starting to see serological surveys that are coming really from different places very slowly, it becomes clear and clear that the disease is not as deadly as it seems to be, and that the Swedish example is not an outlier. So I think I'm really hopeful that in a month, maybe Sweden will consist of a proof that we really don't need these lockdowns. And maybe the whole world will give the Swedish the Nobel Prize for that. It's time.
It's part of the after action reviews, which all of us will have to study the data and decide what we did right and what we need to do better. I want Ariel to refer to you a question that actually refers to something that Adi has said. Adi has said we shouldn't only focus on the mortality and morbidity due to Corona, but we also have to look into what happened to people that have other medical conditions, and that they were concerned, for example, to go to the hospitals and they waited and their conditions may deteriorate and so on. So I would like to ask you, how can we actually reinstate the confidence of the people in accessing the medical facilities? And how can we do it differently if there will be again, some increase of the coronavirus simultaneously.
So I think that part of the answer to this is referring to one of the first questions that you asked me, and that is, what have we learned from this? Mm-hmm. And I think that one thing that we learned is that people do not necessarily look into the facts when they have beliefs. So this is not an issue of health, it is an issue of psychology. I think that if a person feels uncertain in going into the hospital to get his test or to get any test or any exam, it does not matter if you show him that it is 100% sure to do it. He will actually wait a little bit until he gains confidence, and that confidence is dependent on several factors. It is not necessarily the fact itself that it is safe. It is about the fact that his neighbor went. It is about that he became desensitized to the fear. And this also goes back to what Adi said. I'm not as, I think, radical in my view as Adi, but I do definitely share part of what he said in terms of the Swedish experiment. Is the fact that we will reinstate people. I think that we need to right now aggressively motivate them to go and reinstate their lives, because there has been such, I would say, mass scaring on people not going outside. And you can look into statistics. If you look into the Israeli TV, let's say yesterday, although people are allowed to go out right now and go to their jobs and relatively work freely, only about 55 to 60% of the people in Tel Aviv and Jerusalem went out. You would expect this to be now 80 or 85% people going out, and this percentage is due to the fact that people are just scared. So our main issue is to give back confidence to the people and explain them not only by facts but by reassurance that it is okay to go out, and we really need these testing, because I am afraid not of the deaths and severe patients which need to be ventilated due to the corona. I'm afraid from those who are having strokes and did not come on time. And these could gain up to large numbers, because we do not have any herd immunity. I mean, this is a term that many people talked about, herd immunity. But when you have a severe lockdown, you don't have herd immunity. So you're actually, it might be that by locking down, I'm not saying that it's the definite truth. I'm just saying that it might be that what initially saved you is going to be something that at the end of the line, you will pay much more for it.
Yeah, if we could know ahead of time the findings that we find in the hindsight, life would be much less complicated. And I completely agree with you that what we need is a risk communication strategies that does not elevate the concerns and make people frightened, but actually empowers them. People react if they understand, if they know what to expect, and they look at the data that they're exposed to. They don't have all the data that all the researchers have, but they do have the data that is out there through the social media, the conventional media, and so on. And it's also part of our responsibility to try to help in those risk communication mechanisms to be better suited to what the population will actually understand and then be motivated by. If we're talking about
I would just say a word that I can only introspect, and I look at myself. I have a lot of data. I understand that when there's a lockdown, things are much safer than when there's no lockdown. I mean, now I'm in a higher risk of infection, but still, I look at around myself, and when I see everybody going out, I feel safe going out. When I see everybody locked in, I'm afraid of going out. So knowing everything doesn't help me.
Well, you know, when we look, this is part of the social sciences, which we're also in the TAU very strong at. There's not only herd immunity, there's also herd behavior. When I see many people on the street, I believe that it's safe because maybe they know something that I don't. So we need to look at the diversity of people and understand that we have different types of populations, different types of needs, medical needs, social needs, economic needs. And this is something, again, we go back, we say we have to work in an interdisciplinary way. And looking into the interdisciplinarity, I would like to ask you, Arad, how can the industrial engineers, the data science, how can they actually assist and facilitate the public health system so that all of us can provide optimal services to the population during the recovery phase, because we know that we still need to do monitoring and so on? How can actually these two different disciplines work together to promote the public health?
So these are indeed different disciplines, but they can work jointly together. I was mentioning before a way to monitor different regions and use AI system to help make better decision. At the same time, if you think about industrial engineering, it's all about optimizing large systems. And I can even give an example. We were a group of 5 faculty members that went to work with Bnei Brak. Bnei Brak is a religious city close to Tel Aviv, where they had, of course, a large number of cases, actually the largest in Israel. And what we tried to do from an industrial engineering viewpoint is to look at this system as a system of service and demand. So you have a pool of services, services can be groceries, public transportation, shops, schools, even yeshivot and kolelim, I mean, the schools of those religious citizens. And you think about it as a service system. And at the same time, you have a demand for all those services. And what you need to do is to try to optimize those services by using, known methodologies like queuing theories and so on, to try and to answer the demand as much as you can under certain consideration of how many people can be served at the same time, could be placed together at the same location and so on. So many of those disciplines that were applied to optimize facilities or to optimize smart transportation, thing that people are doing on a regular basis, suddenly became so important when you talk about such a complex system like a large neighborhood or a city. And there are already several research works that are going in that direction. And I'm sure that they will be very relevant, of course, not only to Israel, but to other places all around the globe.
Thank you, Rad. Ariel, I would like to refer to you a question of one of our attendees that state that social distancing and regular hand washing, we know that this is needed in order to combat the COVID, but these are difficult concepts for some of our population, especially young children, and they don't always know how to follow it. Now that we're starting to reopen schools, how can we actually instill these types of behaviors and not expose our staff or students to higher risk because of the behavior of the children?
I actually think that this phenomena of kids versus the elderly in this disease is fascinating scientifically. I mean, you have in the same, I would say, genetic pool of population, and the only difference is the age. You see that kids are not infected, and we don't even know how infectious they are. Meaning that if you have a child who has some kind of viral load within its airways, you do not know how infectious this child is. And we know that children are not even getting sick. I mean, so to me, sending children to school should have been done way earlier, because the maximum that you would have gotten is that you would have maybe gotten herd immunity within these children. Now, the main concern could have been these children coming back home and then reinfecting their parents. But I think that we could relatively answer that question easily by answering what is the viral load within these children, because we know that within a given viral load, they would be not infectious. So children, I think should play around, should keep themselves normal, And social distancing and hand washing is always good to stop any pandemic without relation to the coronavirus. So I'm a big fan of getting back to the normal life in terms of children. I mean, this is not only because of, you know, they want them to be educated, but by freeing children to going to school, you also free your economy. You allow parents to go to their work. By allowing that, you allow hospitals to work, and you allow the economy to start being stimulated. There are going to be a lot of prices which we pay by being, I think, too persistent on one dogmatic theme, which is complete lockdown. It is important lockdown because you will always be able to stop the viral spread by the lockdown. However, it is not only a one solution of lockdown. So children, I think, should have been freed and could be freed much earlier. And I'm not worried about that.
Thank you. And there's another question from our attendees from Nelly, and I would like to actually refer to you, Adi. What she's asking is, could you elaborate some more on the academia government collaboration platform that was introduced by Tel Aviv University? And are you aware of any such initiatives that are also happening in other countries?
Thank you. So this initiative, in fact, started with a year-long process called the Tel Aviv University Impact, Social Impact. And during this process, we try to look at how the university can use its advantages, its all the knowledge that is there, how can it contribute to society? And it was a long process that started with brainstorming of 150 people, and slowly found what are the ways that we could contribute. And one of the main things were to make all the knowledge and all the ability to think that is at the university, make it available to decision makers. And so this was, you know, something that is happening in the slow, regular, slow process of thinking deeply about things. And then the Corona story started, and we said, wow, we should do it now. And we created this platform, an internet platform, and it's completely, I'll call it democratic. Every researcher can come and pose a question, open a channel, and other researchers that are interested in this question can join and work together. And the idea is to make very short-term research that are made in order to answer a question and being able to transmit it to the policymakers. And we also have some people who know how to make this connection to whom this should go. And at the beginning, it was questions that were coming from the researchers. Now we also have the policymakers are demanding things, so they know that they can come to us and ask questions, and we can produce research for that. And the second thing is, it's really beautiful that all the universities join. And you know, we talk about the Corona as a problem, but you know that it also generated many beautiful things. And one of the things is that the sense of distance has completely changed. And with the Zoom, it doesn't matter whether someone lives a street away from me, or in Beersheba, or in Haifa, or in Los Angeles. Distances, the whole idea of distance has changed, and you can see a collaboration which is really beautiful. Everybody's volunteering there, contributing their time. You know, instead of doing the regular research, which is advancing their careers, they're really devoted to that. I really don't know of other models like that in the world. I'm not aware. I think it's really unique, as much as I know.
So what you're saying, that we can actually have the crisis become an opportunity for very good things. And
I really think that we should really think how really to, when the crisis will be over, we shouldn't go back to normal. We should really think seriously of how to keep those beautiful things that happen, and see how they can change. For example, if I just think of the whole transportation issue and the traffic jams, and now that people have become more used to using long distance, you know, the Zoom, the the internet communication, we can think how to make balances that will reduce the traffic. But we should think about it. We should not just let it happen, because if we let it happen, people will go back into the old habits. So we should do something to make this stay.
Thank you. In the public health realm, we call this resilience as bouncing forward. And I want, in that spirit of actually looking at the crisis as an opportunity, the last question, Irad, for you, how can we actually use the COVID-19 crisis as a catalyst to rethink our industrial markets, even accelerate adoption of advanced capabilities for the better place in the world?
Well, I think that, COVID-19, like, unfortunately, many cases where we faced a war or a real challenge always increase creativity. You could see it in, World War I and II and so on. And of course, definitely around Tel Aviv University and in Israel at all, you could see so many activity and so many new ideas that came into play. And I think that many of them will continue. And many of those initiatives in many directions will be there. I think that maybe one lesson to take home is not only about innovation and about optimality or productivity, as you are talking about, but about humanity. I think that, for example, when we talk as engineers about supplying the demand, we usually focused on optimality. But here you come to a challenge when you talk about humanitarian logistics. You suddenly have to take into consideration things that you never thought are relevant. So, for example, you're not only supplying the demand by the best price or the highest rate, but you should guarantee that there will be some kind of fairness when you supply that. There is, when you analyze different areas that are exposed in different rates to the COVID-19, you need to think what they need to be supported with and so on. And I think that those type of thinking that actually are integrated in the optimization that we are used to do as engineers is not only mathematically important, but it's a direction of thinking. It's a new direction of understanding what optimality means under those considerations. And I think that since everyone was affected personally by this epidemic, this sense of thought will continue to emerge. People will realize that everybody are connected, and you cannot quarantine an area without being exposed to another area. And all this thinking of working together in a more humanitarian way, I think that will stay with us, and is a good lesson to take home from that crisis.
Thank you very much. Your words remind me of something that Churchill said. He said, it's not the end, it's not even the beginning of the end. At the maximum, it's the end of the beginning. So we have a long way to go, and we should do it together. I want to thank everyone, our panelists and all our attendees for being with us today. The active participation of so many of you is actually part of our joint struggle to contain the COVID-19 and resume normalcy once again. This collaboration and the support greatly empowers our individual, our community, our national, as well as international resilience. So in the same way that the COVID-19 does not respect and doesn't recognize any borders, neither should we. Just in joining forces, in fighting together, in working together, we can and we will make our societies healthier and safer. On behalf of all of us in the Tel Aviv University. I would like to thank all of you for being with us today. I think your support and your solidarity makes all of us stronger and more resilient, and we all deeply appreciate that. I would like now to give the mic, as virtually we can say, to our Vice President, Amos Elad.
Hello, everyone. Just thank you very much. It was a wonderful and exciting panel. Just to say to everyone that right now, Tel Aviv University launched today a crowdfunding effort that is run by all the friends around the world. It's CrowdChange, Tel Aviv University.crowdchange.net, and you're all invited and welcomed. All funding will come into, of course, all these efforts and the research that you heard, the amazing research, and of course, scholarship for students who need it in this time. So you're most welcome to go into CrowdChange, Tel Aviv University crowdchange.net, and bring your friends. And thank you very much for your participation, and hope to see you soon. Thank you very much. Bye-bye, everyone.
Thank you very much, Amos, and goodbye, everyone.
Bye-bye. Bye-bye. להתראות.